I'm going to demo a lymphatic drainage taping on Tucker. Tucker has an old injury here, so we'll pretend that it's more acute and that there's still some swelling happening. So I'll show you how you can reduce that swelling. So I've already cut 2 strips of tape into the fan cutting. Sometimes people call it the octopus because it kind of looks like one. And what we want to do is we want to make sure that when we tear the tape, we separate each one of these finger projections, because that's going to be the hardest part when you go to apply it, is that sometimes if it's stuck to each other, it's difficult to put it down. Another helpful tip is that if you actually fold over each of these, you can create a little tab on the back, which makes it easier to grab it once you put it on. So I'm going to remove the tape, or the paper rather, from the back of the tape at the base. And I'm going to put it here. And then I'm going to put each of these fingers down around the inflamed area with just paper off tension. I'm not going to put any stretch into them. And we're just going to rub those down. Now, depending on where the swelling is located, that's where you will put these fingers. So it'll be different based on each case. There we go. Now I'm going to grab my second one. This tape is more effective if you use 2 of them and you crisscross those finger projections. So for my second base, for his particular application, I'm going to put it up here so that I can crisscross those fingers. And then I'm just going to put these over the other fingers. Now with this, it's most effective if you can replace it every 24 hours until the inflammation has reduced, rather than leaving it on for days. I'm just going to rub those down. And that is the inflammation reduction taping on Tucker. Good job, Tuck.
Bye, Tucky.